Doctor, this calcium score test, is it available at your center?
We are the first to start this particular test. In fact, that was along with the CT angiography way back in 2006. CT angiography required that the first step is a calcium score. And then you follow it up with another injection where you get the dye filling the arteries and showing the passage. But 10 years later, I found out that it is not required to take the patient to the second level of angiography. Limited to first step. It's simpler, faster, totally non-invasive. Enough information is available with that test to categorize patients and plan his preventive management. By 10 years, there was enough data that available worldwide to get the significance of calcium score. There emerged a calcium score 10 years after the introduction of the CT angiography. And today, if you are doing any angiography, it's in the conventional. And we do it only when somebody requires an angioplasty. For the purpose of medical management, this test is the final. Calcium score is the final.
And since when have you been doing this test at your center?
As I said, we started off in 2006 itself, but after 2016, we limited it to only calcium score. So in our center, the calcium score as a sole test came after 2016.
Dr. K. Mukund, so then what is your goal reaching out to the masses with the CAC score?
The plan is to enable prevention of heart attacks by early detection and effective medical management, intercepted by intervention only rarely. And finally, you take the patient up to the age of 8 years without any intervention and take it easy after that age probably. Not everybody might have the same plans, but it is wonderful to see patient or a person or the population free from heart attacks till the age of 80.
Does doing a CAC score involve needles or anesthesia or giving a dye to the patient?
Calcium score imaging is totally non-invasive. It is simply an imaging where you have to lie down for a couple of minutes and the test gets over. What it gives you is a fund of information which can be used in your life to prevent future heart attacks.
So what information do the cardiologists and the patients get from the CAC score?
The score ranges from 0 to can be thousands. Those who have score below 10 can be taken as normal, and their chances of getting a heart attack in the next 4 years is less than the risk that you have on the road. And those who are up to 100, 10 to 100, have a higher risk and need to focus on intensive medical management. Those who are between 100 to 300 have to be ready for any situation which suggests cardiac event, like some discomfort, to be ready for angiography and take it forward. Those who are above 300 should get ready for an angiography so that whether he needs a further treatment like angioplasty or bypass surgery. So calcium score helps a lot in categorizing the risk and then deciding the modality of treatment.
Excellent. So you're saying that this test need not be done yearly?
No, once the person is found positive, you don't need to repeat the test in the next few years unless you are curious about what is happening to the treatment. In fact, pilots who have others' life at risk are made to undergo the calcium score every year. Otherwise, for the general public, you don't need to repeat earlier than 3 years.
So how many CAC score tests have you done at your center, Doctor?
Well, it is in thousands over the years. We started off with the CT angiography. Based on the experience that I went through, I decided that we can limit it to only imaging. And that later emerged as the recommended test as a screening test for all suspected coronary artery disease patients. And now insurance companies are insisting on calcium score test as a screening test to categorize their clients to decide on the premium.
On that account, have you undergone the test yourself, doctor?
Yes, of course. One test that easily carried out and gives you so much of information that one need not hesitate to undergo the test at all. And I have undergone 3 times over the last 10 years and used that information to maintain my health and health of my heart.
Thank you, Dr. K. Mukund, for enlightening us on the preventive tests such as calcium score test, and also speaking to us about the newer generation clot buster that can be given anytime and anywhere with just the use of one ECG and one doctor that can read the ECG and tell us to deliver the tenecteplase. Thank you so much for all the information that you've given us today. Thank you.